Hey, I'm Dr. Joe Naimtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here, and I don't do boobs, bellies, or butts. If you follow my videos, you know that I talk a lot about before and after pictures and how important standardized photography is in cosmetic facial surgery or cosmetic surgery in general. It allows patients to see their results. It allows surgeons to evaluate their work. Taking quality pictures with the same background, the same lighting, the same pose is extremely important. And whether you're a surgeon or a patient, I'm going to show you how to do this. So many of my patients are from out of town, and I'm always evaluating patients or sending pictures to patients and asking patients to send me pictures. So it's very important to take pictures the right way. Stick around, I'm going to give you some tips. So the first thing is setting up correct lighting and background. Now, if you're a doctor, I have a little movable thing here that just somebody built for me, and it is photographic paper, and we can adjust this for the patient's height. If you do full body stuff, you can make a longer one, but quite honestly, you can use a matte poster board. You can just use photographic cloth and put it to the door. You can paint your door black. You don't want a shiny surface. In terms of lighting, you want to use the flash on your phone, and you want to do all your before and after pictures the same distance, the same background, the same flash. For facial surgery, we don't want any jewelry, okay? We want the hair back. And I want to be able, since I do mostly facelifts and eyelids and that sort of thing, I want to be able to see everything from here to here. And if it's a before picture, preferably you don't want any makeup. But some people take their pictures with makeup, but the before and after have to be the same. So no jewelry, no makeup, hair out of the way, and the patient relaxed and without smiles or that sort of things. First of all, if you're using a phone or an iPad, you have to tell the patient where to look. In this case, it's at that round circle on a phone. So you look right here. Sally, look right there. And on a phone, we have the three circles if you're using an iPhone. Now, one of the big mistakes people make is they get too close. And if you get too close, what it does is it makes the nose look real big and everything else looks small. You want to be at least an arm's length away from the patient. Put your chin down. You want the patient in a relaxed position, and you can zoom in. Now, if I'm doing head and neck, I don't need the whole torso and everything. If I'm doing facelifts, I just need that. And our flash would be on, and then we would take our picture. That's how we do a frontal shot. 3/4 shot, I'm going to show you, and I'm going to try and do this without jiggling everything. You're going to line up the lateral part of her nose with the medial canthus of her eye. So turn sideways till those two touch. All right, so the nose touches the corner of the eye. In that way, you'll always have a controlled pose. And you want the patient just to look straight out, and you take that picture. Now, for the side picture, you want the patient to drop their arms to their side, drop their shoulders, and look straight at the wall, okay? And again, I want to zoom in or out and take the picture. Now, for the ground view, or looking down view, I want the patient to bend down, and I just ask them to look at the floor. And I'll zoom in a little bit so I don't have to do any editing to cut out the area that doesn't have background. Now for the other side, we're going to do the same thing. We're going to line the corner of the nose up with the medial canthus of the eyelid. And you have to direct patients because they'll look all over the place. So I'm holding my hand up, not sure if you can see that. And I'm wiggling my fingers and want the patient to look there. We'll take that picture. And then I'll take usually a side picture as well. And that's our facelift series. Okay, now for eyes, what I usually do, and again, I would put a hairband on the patient. And now for eyelid pictures, I'm still an arm's length away from the patient. I will zoom in to what I want. And you want to make sure the patient is not raising their brow, they're not squinting, they're not smiling. They want to be deadpan in all these pictures. And I'll take my picture. Then I'll have them look up at the ceiling, and I'll take that view. And then for my lateral views, I'll have them look straight out at the wall, and I'll take that picture. And that's how we do our eyelid. Now, if you're taking pictures at home, you want to use a solid background. a dark color is always better. You don't want a pattern or drapes or things like that. And again, arm's length away, and you're going to zoom out till you have the top of the head and the collarbone, and you're going to take your picture. Now, if you're using a flash, if the flash is facing this way, coming in across the patient, it's going to cast a shadow. So if you're using a flash, you want to turn your device this way so that the flash comes in from the nose side and there won't be a shadow, because shadows can throw everything off, okay? So if you're doing this at home, it's really best to use a solid background and just follow the same steps that I mentioned before. Send us pictures this series for facelift, neck lift, submenoplasty, this series of pictures for brow lift or eyelid surgery, this series for otoplasty or ear pinning, this series of pictures for lip lift, and this series of pictures for mole and lesion removal. So thank you, Sally, for being a model. And if you take pictures and you're going to send them to us, which we do all day to evaluate people because so many of our patients are from out of town, make sure that you send the patients, send the pictures in their full resolution, because some people will take really nice pictures and they compress them and they send them so small that they're blurry or they're not useful. So you can email the pictures or Dropbox the pictures or text them however you want, but make sure you do it at the actual size. I'm Dr. Joe Naimtu.
LoveThatFace.com.
You got it.